Anyway, so. But these, some of the things that you talked about, learning how to look at
Good morning. Welcome everyone to our graduate student commencement. For those of you who don't know me, I'm Chris Byrer. I'm the director of the Duke Global Health Institute. And I'm happy to say this is my first commencement because this is my first year at Duke. And I'm so looking forward to this wonderful ceremony and spending time with all of you. I know many of the families here have traveled a great distance to be here today, and many others who can't be here are watching online. So there is also a virtual component to this. And to all of you, let me offer congratulations on your students' achievements. It takes a family, it takes a village. I know it takes a great deal of effort and investment to do this. They're a remarkable group. We're so proud to come together to honor them as a community. And can I ask the graduates to thank your families coming? Today, we're honoring 45 students who are earning their Master of Science in Global Health, which is an extraordinary achievement. This is the 13th group, the 13th cohort to complete the Master of Science program, and it equals the largest number of graduates since the program began in 2009. Yeah, that's right. This is a unique class in many ways, and you're going to hear a lot today about their extraordinary efforts and their wonderful hearts and minds. But first, let's spend a minute talking about all those who helped the students arrive at this moment. So we've already thanked the families. You prepared these students to be strong in the face of challenge. And of course, you all have been here at Duke through the COVID emergency. Amazingly enough, the COVID-19 for the United States, the emergency ended today. Kind of an amazing, yeah. It's a fitting day. You have helped them be passionate in their ideas, unafraid to think what they don't know, and you were there for these marvelous young people when they needed encouragement and support. And you taught them to take care of themselves and also to care for others. And you all really represent the compassion and the commitment of these graduates. So thank you for always being there and allowing us the privilege of getting to know these people. I want to thank our faculty and staff, many of whom are here today. The greatest joy of being an educator is the teaching and mentoring of students and seeing their growth. I know our faculty have relished working with these students, understanding their passion and motivations, their goals for themselves and their communities, their goals for global health as global health professionals. And we've been able to see them develop new knowledge and skills and also to become more self-confident and resilient. I want to especially recognize the extraordinary efforts of our education team led by Mary Story, who is here, our Associate Director for Education, and Joe Egger, the Director of Graduate Studies, you're going to hear from later, and the members of the education team, Laura Bay, Lissa McKean, Emily Kerr, Alexis Kucinich, Shania Parker, and Megan Haas, who do so many things every day to support our students. You all know them all very well, and we literally wouldn't be here today without their incredible efforts. So can we thank the education? Graduates, this is your day. It's a day that belongs to all the others in a room and around the world, but you did the hard part. You took the classes and did the readings. You put in the late nights crunching data, showed up early morning for these Zoom calls in different time zones, and you survived biostatistics. So that's it. You completed original research projects and defended theses, and for all of that, you should be extremely proud. I also know that you've been taught over these past 2 years, and the values you've embraced and embodied are really now going to be in your actions. So I know you're also grateful. And I know you're grateful for the guidance and support of your families and mentors, but also the opportunity to work alongside and learn from our global partners. I know you're grateful to have been welcomed into new communities and cultures. And we're fortunate that this group, you were able to travel again. We've had classes who really had trouble traveling internationally because of COVID. And I know you're grateful for each other, for your peers. You have forged bonds that are going to last your careers. I am still in touch with people I did my Master's in Public Health with. I won't tell you how many years ago, but it's 3 decades and counting. And that really is a remarkable network and group to go forward in your careers with together. So I really encourage you to keep in touch with each other in addition to all of us, the faculty. The late Paul Farmer was a global health visionary and a Duke alum, said, with rare exceptions, all of your most important achievements on this planet will come from working with others. As you leave us today and go on to the next great adventures of your lives, embrace those words, think about those words, and bring this collaborative spirit with you wherever you go. Each of you is capable of greatness, but you don't need to be great on your own, and in global health, it's just about impossible, honestly. So share what you've learned, recognize there will always be many around you who can teach you, ask for help when you need it, offer help when you can give it, invite the perspectives and experiences of those around you, especially those who don't have power or privilege. Part of what we are always doing in global health is working to advance equity. And Paul Farmer, of course, also put forward this preferential option for the poor. We are trying to serve people who are really the most marginalized from healthcare and healthcare access. We hope we've given you some knowledge and skills that are going to help you in that important mission, but it's openness, integrity, and compassion that you've demonstrated in these years that will carry you the furthest. If you continue to center those values in your work, we have no doubt you will accomplish much in helping to build a healthier, more equitable, and more just world. So on behalf of the DGHI faculty and staff, our global partners, and your families and friends, I congratulate you on your graduation. We can't wait to see what you're going to do next. In a moment, you're going to hear from some of our selected speakers, faculty and student speakers, which we're really looking forward to. But first, a few housekeeping details. We do have an audience online, so please do silence your phones and devices. And please try to keep the middle aisle clear when students are coming across the stage. Also, immediately after the ceremony, we'll take a class photo out in the atrium. So graduates, please follow the education team outside on the patio once we're done. And then families, the atrium, the reception are yours. After the photo, your graduates will be able to join you. And now I have the pleasure of introducing our next two speakers, one faculty and one student. And these folks, the faculty and the student speakers, were nominated by the graduates to reflect this class and its extraordinary achievements. So these are the people that you asked to hear from today. And first will be our faculty speaker, Dr. Osandu Ogboji, Assistant Professor of Global Health and Deputy Director of our Center for Policy Impact in Global Health and Deputy Director of our new Service Corps in Public Health Policy and Advocacy. Osandu, please.
Thank you, Chris. And good morning, class of 2023. Congratulations. This is a big day for you and I'm sure for your families. Let me start by acknowledging Director Professor Chris Byra, the Duke faculty and staff that are present here to celebrate, your wonderful families, loved ones, friends who are here to celebrate with you, and of course you. It's your day and you should be proud of it. I am sincerely honored that I was asked to give the faculty speech for your commencement. Today is a special day for you all. And over the past 2 years, you've worked so hard. You've read so hard. And I'm sure you've gotten a lot of good experiences here at Duke. And undoubtedly, you faced a lot of challenges, but you survived. And you should be proud of yourselves. We are proud of you. Your cohort had the unique experience of leading the transition out of severe COVID restrictions. And these changes needed to be made to our teaching process. You adapted from Zoom-only classes to hybrid classes, then you moved to in-person classes with masks that were required, and then now we have in-person classes where masks are optional. You dealt with the uncertainty associated with these changes, and despite the challenges, you made it and you're now here. I recall teaching you all in the spring of 2022, and that was the first time I met many of you in one place at the same time. And I was impressed by the bonds that you had created with each other. And I was really impressed that you were really desirous and very motivated to actually learn despite the challenges that you were facing. I'm hoping that the bonds that you have developed, you will carry them on as you move outside Duke, because like Chris said, you can rarely do anything on your own in public health. Today marks the beginning of a new phase in your lives and careers. You now have an advanced degree in global health, not a small thing. And by many measures, you will be the expert in the room on so many topics. People will actively seek your opinion when it comes to important matters of public health in your countries and around the world. And you will have the opportunity to lead or to play key roles in global health projects. I believe I speak for all the faculty at Duke when I say that we are proud of the world-class training that we have given you, and we know that you will do great things. And we know that you will continue to produce consistently good results. However, while having world-class global health training is good and it's necessary, it is not sufficient if you want to make an impact and change the lives of the people that you care about. As public health professionals, we cannot help but care about people. It is not about the disease. It's not about the treatment of the disease. It's not about the grants or the budget. It's not even about the Ministry of Health. Even though all these things are important, it's still about the people. And we'll need to be cognizant of the needs of the people if we want to make a positive impact on their lives. Now, we will need definitely more than the training. You will need more than the statistical significance and the p-values, which you've all learned. And these are important. These values are important, but I'd like to suggest to you 4 more values for your consideration. And that's kindness, respect, being bold, and not being reckless. First, be kind. As you move on, always remember to be kind. As humans, we all crave kindness. It is one of the most important values we can nurture in ourselves and in our communities. When we practice kindness, we are showing compassion, empathy, and respect for others. Acts of kindness could be as simple as sharing a meal with a child in the village that you just visited, or putting in a good word on behalf of a friend or a colleague. But it's important to note that you can also show kindness even when you don't agree with someone or where you think the person does not deserve the kindness. Extending kindness and compassion to all without judgment should be one of the hallmarks of your global health careers going forward. In fact, some people who desperately need kindness are the least deserving of the kindness that you could show them. We can learn from Dr. Jeff Cohen, who is a Jewish doctor who led the medical team that provided care to the Pittsburgh synagogue shooter. The shooter had just killed 11 people and injured more. And Dr. Cohen was tasked with the responsibility of providing care to that shooter. When he was asked, he said, "My job is not to judge him. My job is to care for him. He is some mother's son." Let that sink in. He is some mother's son. If you find yourself in these kinds of situations and you choose to show kindness, of course, it's a choice. If you choose to show kindness, do not allow yourself to feel bad. Rather, be happy that you have done something good. So let's make a conscious effort to spread kindness wherever we go and make the world a better place, one small act at a time. The second value I would like to share with you is the importance of respecting other people. Being respectful is the recognition of the inherent worth and dignity of every human being, regardless of their background, their beliefs, or their status. When we show respect, we are treating others with kindness. But showing acts of kindness without respect is condescending. In your new roles as global health experts, you should be aware of the power differential that will exist between you and the communities that you're going to be working in. And you should take steps to make sure that everyone that you come in contact with feels respected. Recently, I started a small project to develop policy solutions to address disparities in pregnancy outcomes. On this project, I met with a community-based organization of mothers. During the meeting, one of them asked me a question. She said, and I'll paraphrase, "You have never been pregnant, and you will never be pregnant. Why is it that when you write your paper, people will take you seriously, but no matter how much I shout, nobody will listen?" Sadly, she was right. When I still used to practice as a physician, I cared for so many pregnancies, I delivered several babies. So I know the science of pregnancy. I have also trained as a health systems researcher, and that has given me the platform to talk about several important health-related topics. I also have 3 lovely daughters, and I was with my wife all the time. I mean, I'm still with my wife now, right? All through the pregnancies, the baby showers, the ultrasound scans, the deliveries, and all. So I would like to think that I know a thing or two about pregnancy, but despite all those experiences, that woman was right. I have never been pregnant, and I will never be. I do not have a lived experience of being pregnant myself. Therefore, to make any real progress in this new space that I decided to explore, I will need to consider or take seriously the opinions and the lived experiences of the people who have actually been pregnant. Some of you will choose to work on diseases like HIV, diabetes, and cancer without having the lived experience of suffering from any of those diseases. Some of you will choose to focus on improving the lives of some historically marginalized communities without having the experience of growing up in those communities. Some of you will choose to work in countries that are different from the countries that you were born or brought up in, or places that you know. So in all these scenarios, you will be most likely the person with the most knowledge, scientific knowledge, but in many cases, you will not be the one with the most insight or the one with the most lived experience. You may know how best to solve the problem for different people or even for the community that you're talking to at that time, but you may not even know what's best for the individual who you're addressing or the person that's in front of you. As a true expert, you must respect the people who have had these experiences. You must learn from them and work closely with them to develop solutions to their problems. The third value I would like for you to consider is to be bold. When I say bold, I'm not referring to being loud or vocal, even though there are times when that's necessary. Boldness in this context refers to the quality of being unafraid to try new things, being willing to challenge the status quo, and being open to charting a new course. It involves taking risks, being courageous, and pursuing your dreams with determination and conviction. Boldness requires us to have a growth mindset, where we see challenges as opportunities for growth and learning rather than reasons to give up. Anyone who has tried new things knows that it takes boldness. The safer bet instead of boldness will be to conform and to do things the way it's always been done. But if all of us do that, how will society improve? Society improves when people are bold to do new things. Every single achievement humanity has recorded has happened because someone or some people decided to do something differently. So I encourage you to be bold. Don't be afraid to think differently. Try new things. You might be successful, and that will be great. We will all enjoy that success. But even if you fail, learn from it, and you will have become a better person. Now, for those of you who take my advice to be bold and to do new things or break new ground, I have one final value for you to consider. don't be reckless. Boldness is not the same as recklessness. You and your families have invested a lot to bring you to this stage. So take advantage of all the opportunities and maximize them. Not being reckless means that you take calculated risks and you're prepared for the potential outcomes rather than blindly charging ahead, blindly charging ahead without consideration of the consequences. It also requires us to be adaptable and to adjust our course when necessary, while still maintaining our focus and commitment to our bold goals. By being both persistent and flexible, you can cultivate a mindset that will enable you to make significant contributions to global health. In closing, I would like to congratulate you all individually and as a group once again for your achievements today. You deserve all the accolades that you're getting today. And I wish you well. As you begin this new phase of life, I would like you to remember that you have what it takes to change the world. And we cannot wait to hear and to read about all the great things that you will do. For those of you who are still wondering if you have what it takes, let me leave you with an African proverb that I'm sure you will relate to as public health people. It says, if you think you're too small to make a difference, you have not spent the night with a mosquito. So congratulations to you all. And I'll invite everyone to just join me in giving them a round of applause. And now I would like to invite the student speaker, Perla Medrano.
Good morning to my fellow graduates and all of you who have come to help us celebrate this incredible achievement. My name is Perla Medrano, and I could not be more excited to be here with you today to graduate with my amazing cohort. And thank you to my classmates for allowing me to share a few words with you on this special day. I started this program as a student who had just heard of global health for the very first time through a lucky Google search just a few months before the program started. I was excited, but quite scared to come into this program. This was the prestigious Duke University after all, and I was a Latina, of which there aren't many at this university. I felt underqualified and scared that I wouldn't belong. And even before school had started, I was already so impressed by all of you. So much so that after I first met you, I double-checked my acceptance. Could I have been accepted by mistake? Was I the only one who had just discovered global health? Yet only a few days into our introductory courses, I realized I had actually known global health my entire life. I come from an underserved Latino majority border town in South Texas. To this day, my community unjustly faces racial and ethnic health disparities, most of which target the large migrant community in my hometown. It is there that our lives depend on weekly trips across the border to obtain affordable and culturally appropriate healthcare. It turns out I did not have to search far to find the health disparities we learned about in class. This was the first time I was able to put a name to what my community faced, and the first time I was able to put a name to what I wanted to pursue in life. But this was also the first time I was able to attend a top institution, one full of resources and opportunities, with the top student thinkers in global health. I feel proud to have studied in the same classroom as all of you. And I'm thankful for all the moments that we've shared together. We stressed out together while coding in R many times. We explored the best of Durham and our campus. We rooted for Bulls and Blue Devils in exciting games. We shared our favorite stories from our fieldwork. And since our ropes course, we built friendships that have reached great heights. It was an honor to work alongside such brilliant students and faculty. It is in this program that I have learned what true partnership in global health looks like. Together with our collective passion, commitment, and multidisciplinary expertise, we have successfully adapted through unforeseen challenges, including those of the COVID-19 pandemic. And in only 2 years, we have successfully conducted valuable global health research, created an impact in local and foreign communities, and delivered incredible master's papers and thesis projects. But as great as our experience has been in global health, let us also remember that there is still much work to be done. To this day, global health inequities and systems of oppression continue to affect the most marginalized at-risk communities. So as we move on to the next phases of our careers, we must continue to acknowledge the real origins of global health and who it was actually designed to protect and oppress. In 2023, global health can be many things, both positive and negative, but it does not have to stay the same. It is us, global health students and professionals, who have the chance to redefine global health every day. We decide how we frame it, how we practice it, and how we let it affect others. We must be brave to use our training to ask the hard questions, to rebuild systems and make room for those who are currently unheard, to acknowledge who is truly benefiting and whose interests we are protecting, to be activists in our work and address challenges with empathy, to learn from the communities we are trying to help, and participate in solidarity as we fight to protect and improve global health. But before we move on to change the world with our new degrees, I would like to thank the wonderful people who have helped me along the way. I specifically want to thank my incredible thesis advisor and mentor, Dr. Gayani Tilakaratne, my thesis committee members, Dr. Woods, Professor Bodanayake, and Dr. Larry Park, as well as Dr. Mark Janko, Dr. William Pan, and Dr. Charles Marori for their great support. But most of all, I would not be here without the love and support of my family. And so I would like to dedicate this degree to my parents. I am a first generation. I am a first generation low-income student and the eldest daughter to 2 Mexican immigrants who left everything behind on the other side of the Rio Grande for their children. Both of my parents ranked first place in their home universities, and they left in their early careers, risking it all, so that I might begin a life of opportunities here in the United States. I'd like to believe this is one of those opportunities. Mama y Papa, thanks to you, I will now be the first in our family to graduate with a master's degree. And it is thanks to you that I am now joining the statistic of the 5% of Latina women that hold a master's degree in this country. This is why I am especially thankful to have this experience with you all here at DGHI, as not everyone has this opportunity. Education is supposed to be a human right, but it is currently a privilege. And I am privileged to be here today and be able to walk this stage with my classmates. Communities of color are often meant to be on the receiving end of global health and equity efforts, yet are still too often left behind when it comes to education and training. And so if we hope to take the next step forward towards global health equity, we need to fight to close the gap in access to these opportunities. Friends, we have had the opportunity to change our lives by earning this degree. And now it is up to us to use our global health knowledge and training to change the lives of others. I could not be more proud to fight for a better world with you. I am already cheering and applauding for the success that will follow and the impact we will all make through our future global health careers. But for now, let's celebrate this incredible milestone. Congratulations, class of 2023, or as we say in my native tongue, si se pudo.
Thank you, Perla, for those inspiring words. I think you took us all away. Thank you, Perla. And for being such a valued member of this class of 2023. And I'd like to welcome all of you, as well as your family and friends. I'm Mary Story, a professor at DGHI and also Associate Director for Academic Programs. And today I have the pleasure of presenting our Student and Faculty Awards. And let me say that with so many outstanding students and professors in this program, it's quite a challenge to really choose one student and one professor to honor today. We're privileged to work in a community where excellence in both students and faculty abounds. But two individuals that we'll honor today are truly exemplary for their talent, effort, and passion for global health. Our first award is the Madeline Bacuzzi Outstanding Graduate Student Award. This award is named in honor of Madeline Bacuzzi, who graduated from our master's program in 2013 and was unanimously chosen as the most outstanding student that year. Tragically, we lost Maddie to cancer in 2024, but during her lifetime, she exemplified the spirit and dedication that this award recognizes, and we're really proud to be able to continue to celebrate her legacy by presenting this award in her honor. For this award, we asked faculty to nominate students whom they believed excel in the classroom, in collaborative research, and in building the global health community at DGHI, at Duke, and beyond. So we received many glowing nominations, and it's clear that this class, your class, has many outstanding students with worthy achievements. This year's outstanding graduate student has been described as thoughtful, determined, highly organized, as evidenced by the way she planned and carried out her research project. Last summer, she split her research time between Geneva, Switzerland, and Peru, where she interviewed public and private stakeholders, including decision makers, policy makers, and service providers, so at all levels. And she interviewed them about the country's COVID-19 response. According to one of her faculty mentors, her thesis was flawless, with solid methodology and clear and actionable findings. But this student didn't stop there. She's continued to write peer-reviewed papers, policy briefs, and is actively planning a series of roundtables in Peru to share the results of her research. These actions speak to her passion to achieve a meaningful impact, as well as her sensitivity to local priorities and local contexts. As one nominator wrote, she's an inspiration and model to me in her approach, awareness, communication, and thoughtfulness. Nominators also praise the student's leadership in her cohort, and they describe her as a compassionate classmate whose peers seek out for guidance and support, and a community builder who has helped this cohort really bond together for life. For all these reasons, we are proud to present this year's Madeline Bacuzzi Outstanding Graduate Student Award to Stephanie Stan. And now we'll present the Global Health Graduate Professor of the Year Award. We're So fortunate to have a remarkable group of professors and mentors inspiring students like Stephanie and her classmates. These professors teach our core required courses as well as elective courses across campus. They also serve as research mentors to our students, helping them carry out their research projects that can involve multiple partners and complex research methods. Each year, we ask the students to put forward nominations to recognize one faculty member who has gone above and beyond to mentor, teach, and support our students. This year's winner is not just an outstanding teacher, but a shining example of how passion, creativity, and total devotion to students can create a transformative experience for our learners. This professor brings incredible energy to every lesson, making his classes fun, engaging, and inspiring for students at all levels. Students say he makes complex topics understandable and relatable. And as one student noted, I find myself every day quoting him or talking about something I learned from him. Another student praised his teaching excellence by asking, who else could make a 2-hour class that begins at 8 o'clock in the morning so fun and compelling? Students are equally enthusiastic about this professor's dedication outside the classroom, saying he shows extraordinary care for them and their success. As one student commented, his knowledge, passion, dedication, and wisdom are a perfect example of what a model professor should be. And so I'm pleased to present the 2023 Global Health Graduate Professor of the Year Award to Dr. Gavin Yanni. Congratulations to all the recipients of our awards, and thank you for your outstanding contributions to the community. And now it's time to honor our graduates, so I will ask Laura Bai to come to the stage to begin our recognition ceremony.
Good morning. I'm Laura Bai, DGHI's Assistant Director for Curricular and Student Affairs, and it's my distinct pleasure to present our 2023 graduates. Each of our students will walk across the stage as I read their name. I just want to remind you that we do have people watching the ceremony online, so please refrain from using the middle aisle so that our online audience can clearly see the stage. And as you've seen, we have a photographer capturing pictures of this moment, so those photos will be made available to all of you for a few days after the ceremony. So let's begin. Jacob on. Jacob worked with Dr. Tan at Duke NUS to evaluate patient safety practices in Asia Pacific countries based on a World Health Organization framework. Kayla Balsh. Kayla is studying the impact of resource extractive land concessions on malaria incidents in the Peruvian Amazon. Her mentor is Bill Pan. Carmen Kukalan. Carmen conducted a quantitative and spatial analysis study regarding the association between low food access and mental health among adults living in Miami-Dade County, Florida. Her mentor was Emily D'Agostino. Isaac Eves. Using the 3 delays model, Isaac assessed the perceived barriers to surgical care in Robeson County, North Carolina. His mentor was Tamara Fitzgerald. Demope favole. Demope worked with Osondo Okpuoji to build a decision model to forecast the health and economic benefits of ART adherence interventions among adolescents living with HIV in Tanzania. Parker Frankowitz. Parker investigated the barriers and facilitators to emergency care in the Kilimanjaro region of Tanzania. Her mentor was Anjani Joyner. Lisa Gachara. Lisa's thesis centered on the universal language of story, reviewing narrative development within provider-parent interactions to guide vaccination decisions. Her mentor was Lavanya Vasudevan. Daniel Hanbury. Daniel analyzed the risk factors for inter- and intraspecies transmission of respiratory illness in the Democratic Republic of Congo. His mentor was Chris Woods. Sandy Hatum. Sandy worked with Michael Ralph to study intimate partner violence and its associated psychosocial factors among women with HIV in Rwanda. Yes, Sandy. Kayla Hendrickson. Kayla explored the characteristics of women who attended cervical cancer screenings versus home visits in rural Western Kenya. Her mentor was Megan Hutchko. Elena Johansson. Elena's mixed methods study analyzed the drivers of COVID-19 vaccine hesitancy among 20 to 30-year-olds in the United States. Her mentor was Lavanya Vasudevan. Monique Kilmanson. Monique performed qualitative research in the field of maternal health tech regarding how companies serve minoritized populations in the US. Her mentor was Erica Green. Chandra Mackey. Chandra analyzed patient and provider perceived delays to snakebite care in Amazonas, Brazil. Her mentor was João Visosi. Perla Medrano. Perla studied the prevalence and predictors of antibiotic prescription use among patients hospitalized with viral lower respiratory tract infections in southern province, Sri Lanka. Her mentor was Gayani Tilakaratne. Benjamin Makumbia. Benjamin performed an assessment study to determine the feasibility, appropriateness, and usability of mobile clinics to provide neurology care in Uganda. His mentor was Tony Fuller. Judith Mubobia. Judith's thesis, titled Let Him Die, He Caused It, was a qualitative study on cancer stigma in Tanzania. Her mentor was Brandon Nettle. Claudia Salgado. Glaucia examined the perceptions of racially diverse caregivers and pathways to the diagnosis of Alzheimer's and related diseases. Her mentor was Regine Preschel Bell. Paula Jeru. Paula surveyed health facilities in Western Uganda to determine health system capacity for epilepsy care. Her mentor was Deborah Koltai. Armstrong Obale. Obale developed harmonization strategies for injury data discrepancies across low and middle income countries. His mentor was João Visosi. Ekene Gosakwe. Akane performed a scoping review on the impacts of gender on access to routine immunization among migrant populations in 10 priority countries. Her mentor was Gavin Yamey. Alicia Parsons. Alicia investigated the predictors of adolescent and early alcohol use among orphaned and separated children in 5 low and middle income countries. Her mentor was Chris Gray. Zoe Pettit. Zoe completed a feasibility study in Uganda of non-invasive intracranial pressure monitoring for adults after traumatic brain injury. Her mentor was Tony Fuller. Suhana Hosani. Suhana studied the cancer stigma experienced by pediatric cancer patients and their caregivers in Mwanza, Tanzania. Her mentor was Kristen Schrader. Minahil Rehman. Minahil identified evidence-based strategies to strengthen the ability of social enterprises in low and middle income countries to scale health impact. Her mentor was Krishna Udayakumar. Maeve Salm. Maeve worked with Dorothy Dow to study the barriers and facilitators to preferred contraceptive experiences for young women living with HIV in Moshi, Tanzania. Pooja Singh. Pooja examined sexual and reproductive health among orphaned and separated adolescent girls in 5 low and middle income countries. Her mentor was Chris Gray. Stephanie Stan. Stephanie explored the barriers and enablers to Peru's COVID-19 pandemic response, as well as the local, regional, and global implications. Her mentor was Krishna Udayakumar. Kristen Stark. Kristen designed an intervention to improve myocardial infarction care in a Tanzanian emergency department. Her mentor was Julian Hertz. Anna Strasma. Anna evaluated kidney disease characteristics, prevalence, and risk factors in Leon, Nicaragua, using a population-based study. Her mentor was Nathan Thielman. E.E. Sway. EE explored public-private partnerships in India's COVID-19 response. Her mentor was Krishna Udayakumar. Vivian Wambugu. Vivian reviewed community-based interventions to reduce disparities in the management of severe uncontrolled hypertension in the southeastern United States. Her mentor was Sarah LeGrand. Maya Wilson. Maya explored the association between mental health and disability among sexual and gender minority populations. Her mentor was Chris Gray. Liang Yao. Liang took inspiration from the FLASH study and investigated the association between adolescents' eating behaviors and their attitudes and food preferences. His mentor was Emily D'Agostino. Yun Yuan. Yoon performed a mixed method study to investigate the association of alcohol use with risk of malnutrition among injury patients in Tanzania. Her mentor was Joao Visosi. Dao Hong Zhang. Dao Hong evaluated changes in financial burden and healthcare utilization for cancer patients in East, Central, and West China. His mentor was Shenglang Tang. Tianyi Zhu. Tianyi investigated the neurodevelopmental effects and birth outcomes of perinatal PFAS exposure through drinking water. His mentor was Li Ping Feng. This completes our 2023 graduating class. And as our students, are making their way back to their seats, I'd like to note a few things. First, if you came through the front entrance today, you probably noticed the banners we put in front of the building. These banners reflect DGHI's core values: humility, compassion, respect, cultural sensitivity, collaboration, diversity and inclusion, and a commitment to impact. Graduates, thank you for how you've upheld these values during your time here. You guys, you're the best. I encourage you to embrace them, to remember them going forward. So, second, I ask everyone to remain seated as our graduates leave the hall. Once they've exited, please join us in the atrium for the reception, great reception to follow. Graduates, I'm going to ask you to follow Lisa and your classmates to the back steps for class photo and to pick up your class gift. So for one final time, class of 2023, congratulations from all of us at the Duke Global Health Institute. Walk out, we'll walk on this side again.